Can I have my slides, please? A very good afternoon to everyone. Thank you, Lakshmi ma'am, for inviting me here. I have amazing memories from Nagpur. I did my MBBS from Savangi, so we used to always be around in Nagpur, and ma'am really looked after throughout. And it's an honor to be present here in front of all of you and giving this talk. I'm going to be talking about good practice guidelines for setting up an IUI lab. I'm not sure how many of you already have IUI laboratories or how many of you want to start an IUI center, but hopefully, hopefully by the end of this lecture, we'll have a certain idea about what to buy, what consumables to use, etc. Now, before we begin, we all know that ICMR has revised its guidelines, and instead of the primary center, secondary center, tertiary center, it's now 3 levels: level 1, level 2, and level 3. And that's something that we really need to worry about, because now when we talk about an IUI unit, that comes under level 2. Earlier it was 1B. And when it comes under level 2, you have to register with ICMR before you begin the clinic itself. So these are the guidelines that you really need to worry about. Basically, even if you're doing AID where you're not processing the samples in your own center, then also a registration with ICMR is mandatory in the current scenario if the bill comes into play. Now, earlier on when we were talking about IUI setups and what all registrations that we really need for an IUI setup, what we did with ISAR last year was under Dr. Rishma Pai was to create an algorithm for setting up an IVF unit or setting up a laboratory. And again, that was in the ISAR TOGs. It's on the website, so that's something that you can always go back and refer to. And it's in a form of an algorithm where, like if you mentioned just the medical legal aspect, we've tried to create like which levels need PNDT, which levels need CEA, which levels need the ICMR bill, etc., etc. So all of that has been devised for all of you. Now, basically, when the IUI lab now comes under level 2, you will now end up requiring PNDT as well for an IUI unit, as well as the ICMR guidelines. CEA, wherever it runs, like if it's there in Maharashtra, I'm not sure, but it's there in Uttar Pradesh as well as in Delhi, and that's why we need to register under CEA as well. And the other guidelines or the other registrations that you need to consider about are the fire safety, biological waste management, ISO, etc., etc. So these are all your registrations that you need to worry about before starting a unit. Now, whenever we start a unit, we basically divide the IVF or the IUI lab into 2 components. So what you're going to do is you're going to divide it into a non-sterile area as well as a sterile area. Now, when you're only starting an IUI laboratory, the sterile area will only have the laboratory where the processing will happen and a clean room where the insemination happens. So only these 2 rooms are required in the sterile area, and your non-sterile area will basically consist of your reception, the waiting area, your store, record room, all of those things. Now, basic guidelines have not been mentioned, but when we were, again, this year when we were working on the embryology consensus, we've from ISARs actually put certain minimum requirements where, like if you're planning to start an IUI lab or an andrology lab, at least 100 square feet or a 10 by 10 room should be dedicated for that laboratory. That's the minimum criteria that now ISAR is going to propagate. And again, the lab area always has to be in accordance to the number of cases that you're doing. Now, if I'm only doing IUIs, but I'm doing a lot of IUIs, I'm doing 50 IUIs in a month, then probably this 10 by 10 room would not be sufficient. So always plan accordingly and always have a provision for expansion, because especially when you're doing about 30-40 IUIs in a month, you would want to expand to IVF, and that provision should always be there, because some of your equipment that you're buying for an IVF unit can actually be used in the, for an IUI unit can actually be used into the IVF unit as well. Right, so this is something that we all need to consider. Now, whenever we design a laboratory, there are 6 basic things that we need to worry about. The location of the lab, the infrastructure, the floor plan, like the access, who's allowed in the laboratory, what materials are you using, and obviously pest control for that unit. Now, whenever we talk about location, it always should be away from traffic, away from dust, pollution, preferably on a higher floor. Basement should be avoided. So generally, you should not have a lab in a basement floor. You should not have a lab on the ground floor as well, because again, because there's a lot of flow of patients coming through, you'll not have the cleanest air in the laboratory, and that's something that's going to hamper your results. And again, moisture prone areas, again, like the basement, should be basically avoided. Infrastructure I'm going to cover, but basically it consists of 4 points: power, water, air conditioning, and light. And basic things that we really need to consider here is that you should have adequate power points, you should have a UPS backup, no water source near the laboratory, mild light, so yellow LED lights work very well in an IUI unit or an IVF unit. Try and avoid whiter lights, because again, they are more closer to the UV spectrum, can hamper your gametes. Again, the materials that you can use always whenever you're now thinking about starting a unit, especially the ones who are going to start IUI units after this masterclass, there are so many new compounds which are available which don't emit VOCs. Even the paints that we use nowadays don't emit VOCs, and VOCs is one of the most important components in a gamete processing unit, which can actually affect the quality of the gamete, and you'll not even know about it. You'll think that the sperms are moving very well, but the VOCs are going to enter and hamper the DNA of that sperm, and it will obviously not result in a pregnancy, can result in biochemical pregnancies, can result in miscarriages, etc., etc. So that's something that we really need to worry about. So whenever you're planning to start a unit, having a VOC-free unit is something that we should aim for. And again, you have latex paints which are available, you have modular labs which are available, which can all be thought about when you're starting a unit. And pest control should be done before you start the unit, because once you've started the unit, pest control cannot be done once the lab is functioning. So that's something that we need to think about early on. This I've already covered, but again, when I talk about air conditioning, have a separate air conditioning unit for the IUI lab. If you're in a hospital or a multi-speciality hospital and you have a central air conditioning, there also I would suggest that you have an exclusive air conditioning system for the lab, because the vents or the ducts that are being used for that main hospital will carry everything, all the air from all the infected areas would come into those ducts and then come into your IUI or your IVF lab, and that's something that you don't want. So have an exclusive system in the lab. And especially when you're thinking of an IUI lab, you don't really need to invest in like an HVAC system or an air handling unit. Having a simple basic air purifier can actually help you, or a small Coda tower can actually help you in maintaining the air quality in that laboratory. Now, when we talk about staffing, ideally you should always have an embryologist whenever you're starting any kind of an ART unit, but in our country, because there is a huge shortage of embryologists, there are only about 700 embryologists in the country who are actually qualified. So when you're only thinking of an IUI unit, at least the thing that you should have is an embryology technician, and this embryology technician should have at least a BSc in basic biological sciences and adequate experience. So this is something that is being recommended by ICMR as well, and this is something that all of us should follow in routine practice. Now, all of you can also prepare samples, can also do semen analysis, and all of that can be done. So that training should be there before you start the unit. And I personally feel that if you don't have an embryology technician, and if you're doing if you're just getting samples from a laboratory and doing the IUI in your own center, at least look at that sample in a microscope. At least that much should be done, because most of the times when samples are being transported from one lab to the other, they're not being transported in the best kind of conditions, and by the time the sample comes to your unit, most of the sperms would probably be dead by that time. So by taking a small slide and investing in a small microscope, you'll be able to actually quality control, have a check on the quality control of all your samples, and that's something that at least that's the minimum requirement that should be done for any IUI unit. Now, this is a very common question that a lot of people ask, and that's basically what kind of equipment should we invest in. Now, again, it depends on the number of cases that you're planning to do, the trajectory that you're planning to follow, or the number of patients that you will get probably in 2 to 3 years. So always plan in advance. The minimum required equipment is basically a laminar airflow, and that's where your samples will be processed. A CO2 incubator is not mandatory. If you just have a heating stage, that can basically cover for your CO2 incubator. So if any company comes up to you and says that we'll set up your IUI lab, we'll put an incubator in place and all of those things, do understand that a CO2 incubator is not mandatory. You'll not be using it for most of your samples. A centrifuge is of utmost importance. Then obviously you would need a simple microscope in the lab, and a sperm counting chamber, preferably a macula chamber, is something that is preferred. Now all of this, like I mentioned earlier, should depend on the number of cycles that you're planning. All the equipment should have validation, should have calibration, as well as AMCs in place. And again, these are all mandatory and you should have a documented evidence for it. And the SOPs and instruction manuals should be in place so that if there is any kind of breakdown, at least whoever's working in the laboratory can actually do the troubleshooting for your lab. Now this is the microscope that's preferred. It's a basic monocular microscope. It's a simple microscope, goes up to 10, 20, 40 and 100 times objective, and that's something that all IUI labs should have. A centrifuge can be a basic centrifuge like the REMI ones which we all have, or it can be a digital centrifuge which are the new ones which are coming up. You really don't need to have a heat controlled centrifuge, and that's also something which a lot of companies will try and sell to you. A basic centrifuge is sufficient because sperms, when you look at the metabolism of sperms, they are more active at 37. So when you're doing the processing at room temperature or at 24, you're actually preserving the metabolic activity, and they can actually conserve their energy for a longer duration. So that's something that we now need to think about. Again, like I mentioned, an incubator can be utilized, but it's not mandatory, and these are the two kinds of incubators that are available. So this is a oven which only maintains the temperature. So in a scenario where you're getting a lot of samples in, this incubator will be used just to hold the samples in at 37 degrees till you start the processing. A CO2 incubator is of no use in the current scenario because whenever we are doing IUI, we are using a Hippies buffered media or a HTF, which is human tubal fluid, as the main media that's being used for the IUI process itself, and that does not require CO2 to maintain its pH. So again, investing in a incubator of this sort, which is almost to the tune of 6 to 7 lakhs, is something that is not mandatory. And like I mentioned, a digital heater is something which will actually make your life very, very easy. It's a very cheap alternative to the incubator. This will cost you about 30 to 45,000, and it will give you equivalent results as far as your sperm parameters are concerned. But what you really need to invest in is a good laminar airflow, because that's something which will actually maintain the quality of air inside your processing unit, right? And whenever we are talking about a laminar airflow, there are two types of laminar airflows which are available. One is the horizontal laminar airflow, where you will have the HEPA filter right here, and the one which you're seeing here is a vertical laminar airflow, where the HEPA filter is actually above. And what is actually recommended is that you have a vertical laminar airflow in your laboratory. This is again, this is our IUI lab. You can't see the laminar here, but that's the basic setup that we have. It's a modular unit where we have a place for the semen analysis, a small incubator, all the other reagents and all the tests which we do for this male partner are actually located here. We also have a witnessing system which is right here, which is something which I will talk to you about in the next few slides. Always understand that whenever you're commissioning a new laboratory, like you've purchased all this equipment, do understand that if you start immediately, your results will not be great. Because the things that you've purchased, especially the laminar airflow as well as the incubator, both are high emitters of VOCs. So you have to run them for at least 3 to 4 weeks before you actually start your unit. So that at least that much period of, this is known as a burn-in period, at least 3 weeks of burn-in is mandatory for all units, and also off-gassing of disposables is something that you can do in your laboratory just to reduce the VOCs. Now certain good practice guidelines for any ART unit. First of all, you have to ensure the safety of your staff and also your safety of yourself. So vaccination is something which should be advised for all of your staff, especially for Hep B, and that's something that should be done. So this year with ISAR, there was a survey which was done, and in that survey, what was revealed was that almost 90% of the doctors who are working in an ART lab are immunized for Hep B. But when we talked about the paramedical staff, only 40% of the paramedical staff was actually immunized for Hep B, and that's something that we now need to look after, because most of the patients that will come to you, these are viruses which are now getting very common. Most of the patients will come to you with Hep B, VDRL, HIV, etc. And then taking precautions in such a scenario is something which is mandatory. Also, having SOPs for managing needle stick injuries, etc. is something that you should have in your lab, and all of your staff should know about it. We've all seen good news. I think all of you would have seen good news, and the kind of mix-ups that can happen. And that's where identification and patient traceability comes into play. And whenever we're doing IUI, it'll still be important, because here also you're going to process samples, you're going to probably use some, in certain cases, donor samples, etc. And then having a witnessing protocol for your IUI lab is also something which is of prime importance. So with the consensus statement that's coming out in March this year, we've put up, for IUI, we've put up at least 3 places where witnessing should be done. First is at the time of semen collection, and whenever you're giving the container to the patient, ask for the photo ID of the patient, ask the husband to say his name, say his wife's name, his date of birth and his address, just to cross check. Always check that the person's face matches with the photo ID, because that also is very common. They'll give you someone else's ID and someone else comes and gives the sample. And so that's one point where we need to do a witnessing. Second point is at the process itself. So when you're doing the insemination, ask the wife to repeat all of those things. And again, when you're doing AID, which is when you're using a donor sample, apart from all of these, the ID of the sample is also something that should be witnessed. And why we are witnessing the ID of the sample? Because we want to now cross-check the blood group and the kind of parameters that are available for donor samples, and that should be cross-checked. Again, protective measures, always treat any fluid which is coming into your lab as infected. So taking universal precautions is something which is mandatory, even if you're doing just IUI. Lab clothing should be, again, autoclaved. Always change into lab clothing and then only enter into an IUI processing unit. Don't keep the centrifuge in your OPDs and just prepare the sample in your OPDs. Always have a separate room which is sterile for all of these processes. Hand washing is one of the most important factors here, because that's something that prevents infection. That's the most effective in preventing infection, and that's something that we all should really follow. I was talking to you about biomedical waste guidelines, and that's something that's becoming very, very strict nowadays, especially in my state. In UP, it's becoming very strict. I'm sure Maharashtra is stricter. So always follow the exact protocol of where to throw which thing. Last few slides. Coming to consumables and media. So these are the basic consumables that you would require in an IUI unit. So you basically require semen containers. You'll require these kind of test tubes. This one's used for density gradient. This one's basically used for simple wash and centrifugation or swim up. And again, you'll require a BD syringe and an IUI cannula. These are the basic requirements of consumables in an IUI unit. Lastly, coming to frozen sperm or donor samples. Now, whenever we are using donor samples for IUI, it is mandatory that it should be taken from a semen bank and not from a pathology, because when you're taking a sample from a semen bank, that is being tested for VDRL, HBsAg, HIV, HCV, and these are being quarantined. If you take it from a pathology, you have no idea what kind of infection that man or that sample could carry, and then you actually can get into a huge amount of legal troubles if you use a sample from a pathology, and even if one of your patients gets infected. And always understand that one-time screening of HIV is not the best. So when what these banks do is, at the time of sample collection, they'll screen for HIV, and then after 6 months, then they'll screen for HIV again, and then only that sample is available for being used from a semen bank, and that's something which we can't follow in routine practice. So that's something. So whenever you're thinking of using a donor sample, please always use frozen samples, and there is no difference in using between frozen samples and fresh samples. There's no difference in the results. And obviously, you can also match the blood group and the physical characteristics, etc. Always try and follow the guidelines of the suppliers, of whoever's supplying the consumables or even the samples with you. Preferably, what is preferred is that you have at least a CE mark for all your consumables as well as your medias. And lastly, this is my last slide. Just to conclude, whenever we're thinking about optimizing our IUI centers or like having the best kind of IUI units, these are the 3 pillars that we need to consider. Have the best kind of infrastructure, the top quality equipment, and the highly experienced staff, and obviously your results would be unmatched. So with this, I'd like to thank all of you for your patient listening. If you have any questions, I'll be happy to answer. Thank you so much.